young women who've been teaching us Torah through the Bar Mitzvah program, and also one of the health officers for Contra Costa County. And Ori has been advising us since February or March on a very, very regular basis. And really, more than anything, has been Ori's generosity has been what's made it possible for us to manage COVID as well as we've been able to manage it as a community. So thank you, Ori. Thank you for taking the time to be here tonight. And please.
Sure, I'll take it away. Thank you, Dev. And just so you guys know, I think we right now have you all on mute, and you'll get a chance to talk. I'm just going to take like a few minutes just to give the update on what's going on with COVID and with the vaccine. And then there were some people who sent some questions in ahead of time, so I'll read those and try to answer those as best I can. And then we'll open it up to questions either verbally or through the chat in a few minutes. The short answer of how things are going with COVID is that they are getting worse as far as number of cases that are going on, as far as hospitalizations that we're seeing. I know the Contra Costa County data really well because that's where I work, but I can tell you about our last peak was at the end of July, and we had 110 people at the hospital then, and I think 3 days ago we matched that record, and by today we're up to 135. So the shape of the curve is sort of pointing straight up, and we haven't even gotten what we are expecting to be the Thanksgiving peak. There are so many cases coming through the state database that they no longer have enough staff power to transmit them to the local counties. Usually they have a human being that looks at every case and makes sure it's not a duplicate. And I think they're now looking at doing it automatically because they're sort of overwhelmed their staff at that level. So that's just another example of how the numbers are going up. We expect them to stay up for quite a bit because even though most of the Bay Area has a shelter in place that went in, including Alameda County, where I think it's going into effect tonight, the Thanksgiving gathering numbers will continue to rise, and those will have some associated transmission. And we expect more gatherings to happen, even though there's a shelter in place in around Christmas, Hanukkah, holidays, where people often take time off and gather. And the vaccine will not be here in significant enough numbers to really impact transmission for a little bit of time. I'll talk more about that in a second. Hospitalizations are going up, as I said. Most of the Bay Area, the concern when people say hospitals are filling up, it's not actually the physical space that's filling up, it's really staffed beds. So healthcare workers are in short supply. So many hospitals have extra physical beds or rooms, or they could double people up or use the perioperative area. It's just the need for staff that is short, and it's harder to get. There's a whole bunch of people that usually travel to hotspots, traveling nurses, and not so much for doctors, but for other staff categories. But they're hard to find now because they're needed everywhere, basically. The mortality rate for people who are hospitalized. So if you get COVID, your chances of being hospitalized are obviously worse if you're older. They're on average about 10% of people are hospitalized. I think the state of California is using 12%. In Contra Costa, we've done the math. And with our age distribution of who's getting COVID, it's about 8%. So somewhere around the 10%. If you have COVID, you'll be hospitalized. And of those, about 25% will get sick enough to go to the ICU. So some places have enough hospital beds, but not enough ICU beds. And that's actually what the state is now using as its trigger for initiating a state order to shelter in place. They're divided the state up into regions. They're looking at ICU capacity in each region because that seems to be the most limited resource in the hospitals. And then if it gets below 15%, they trigger a shelter in place for that region. That decision, the Bay Area health officers felt that that was a little late in the game to issue a shelter in place, that it doesn't leave enough runway to not overwhelm the hospitals, which is why the 5 biggest counties plus the city of Berkeley issued our shelter in place that went into effect on Sunday, even though there's still about 25%, 24% of ICU capacity left here. We didn't want to wait till it got below 15%. The testing in most counties is relatively overwhelmed. I can tell you a month ago, we had plenty of appointments in Contra Costa. Now all our appointments are taken. There's several day wait to get an appointment. We do release some appointments every day for symptomatic patients and patients and healthcare workers, but we probably release about 500 a day, but they're all taken. If you're willing to pay cash, it's easy. You can go to some testing sites that accept cash. If you want to use more of the public health system or your insurance, it's a little harder to get an appointment these days, although there are more of these short-acting antigen tests, and I can talk a little more about those later, available. That are, the short answer on those is those are pretty accurate. They're pretty good at telling you, they're not as sensitive as the PCR test, but they're pretty good at telling you if you're infectious, if you have COVID and you're infectious. The other way to say that is the PCR tests are probably oversensitive. Like they'll tell you you're positive for weeks after you were infectious. That's another way to think about that. There were a few questions in the chat about when are asymptomatic people, you know what, I'll get to that in a second. I'll just give a couple more general comments. Vaccine, that's the question of the day. It's in the news all the time. There are no vaccines that have been approved by the FDA yet. We are expecting the first vaccine to be approved probably early next week, which is likely the Pfizer vaccine. That's the first vaccine that was applied for, followed shortly thereafter, maybe about 2 weeks later, by the Moderna vaccine. These are both mRNA vaccines. There's a subset of the RNA that makes up the virus that is coated with a proprietary fat layer in each one. They both have to be kept in cold freeze and transported in cold freeze or on dry ice. They are both, according to the companies, very effective, 95% effective at preventing COVID, and even the 5% who get it get on average much milder disease if you get the vaccine. They're both 2-dose vaccines. So for Pfizer, you get the first dose, and then 3 weeks later, you get the second dose. For Moderna, the second dose is 4 weeks later. You shouldn't mix and match, so the second dose should be the same kind that you got the first dose. The feds are shipping it to the state and the counties, and the state is sort of coordinating the distribution. There are some special programs to vaccinate the staff and residents of nursing homes that the feds have contracted with 2 large national pharmacy chains, Walgreens and CVS, to do. And I am really hopeful that that pulls through. I am not counting on it because I just don't know where those pharmacy chains are going to get the staff. They're not used to going out to nursing homes and doing a lot of vaccinating, and I just don't know where they're going to get the staff to do that. There are some staff available, but I don't know if they have enough at the scale that they need to. So I think every county is now sort of trying to do a calculation for the first doses that they're going to get, are we going to use them for just healthcare workers, or do we allot some to nursing home residents? And there's a lot of articles. There's an interesting article about that in the New York Times, the equity considerations. There's equity considerations about essential workers on the one hand, who tend to be more Black and brown. And then there's mortality considerations because older people are more likely to die. So it's a really complex conversation that every local health department is sort of figuring out for themselves. In Contra Costa, we have an ethical allocations committee that looks at all of that. So the first wave of vaccine, what's called Wave 1A, the feds, the committee that advises the CDC called the ACIP committee, recommended that those first doses be safe for healthcare workers and residents of either nursing homes or assisted living facilities. In reality, the way the vaccine will get shipped is there won't be enough in the first shipments, even for that full first wave. So they will need to decide a subset of healthcare workers and nursing home residents who will get it. And then they're looking at sometimes the ages, sometimes the medical risk, sometimes the acuity of the setting, like ICU or ER employees would get it first, or nursing home employees would get it first. And every place is sort of making their own decisions there. I think I'll stop there. I think as far as timing of the vaccine, that's a common question. We expect the first doses to come as soon as next week, like the day after the FDA issues the emergency use authorization for the Pfizer vaccine. In Contra Costa County, we're expecting to get the Kaiser vaccine first because we have a bunch of these deep freezers. Some other counties may get more of the Moderna vaccine. Although Pfizer will come out first, it's much more of a logistical challenge to distribute because once you take it out of the deep freeze, it's only good for 5 days. So we're going to get a bunch of Pfizer, but we have to distribute it to places that can put it into arms in five days. So lots, and I'll start going through the questions. There were a few themes. The vaccine themes, there's a whole set of questions about how do I know it's safe and effective? Which is a very good question. I have to tell you that I am by nature not an early adopter. There's some doctors who like to give you the latest thing right off the bat. I like to see something out there and proven and safe for a while. So my instinct is not to be an early adopter, and I'm really trying to balance that with the knowledge that an effective vaccine could really make a huge difference for personal safety, for isolation that so many people are having, for the economy, all these other factors. So we know, if we believe the companies and their data, nobody's dropping dead after getting the vaccines. Very rare. And they're very effective at preventing COVID infection, at least in the short term. Do we know whether they prevent you from getting it and transmitting it to others? Not yet. We don't know if they just prevent you from showing signs of the disease or also from transmitting it to others. That's an open question. Do we know how long the protection lasts? Also not yet. There are some scientific reasons to believe that it will last at least a few years. And I won't get too much into the weeds there because we don't know it for sure, but we do know that kids who get coronaviruses generally have immunity for at least 5, 6, 7 years, which is why younger kids, we think one of the reasons why they transmit COVID less is because they have cross immunity from other coronaviruses they've gotten in the past that have caused a common cold. Do we know about long-term side effects of the vaccine? No, we don't. So yeah, people are asking, how do I know that 6 months from now I won't, develop some weird neurological side effect? And we don't have a way to tell you that so it's a little bit of what is your own risk tolerance, what is your own personal calculus about the effect of COVID on your life, your fear of COVID versus the fear of potential side effect from the vaccine. I wish I had a better answer there, but I don't. Would I get the vaccine? I think so. I think it's got enough, even though I tend to be a late adopter, it's the upside is enough for me. I'd love to see, I probably won't be in that very, very first wave that's offered the vaccine. I'll probably be in the second wave, like in January, public health workers and so forth, but I think I'll get it at that time. There were also some questions about infectivity, and then some specific scenarios. So the question is, how do you know how long you're infectious, whether asymptomatic? So we know asymptomatic people can transmit the disease. In general, we think the window of transmission is from about 2 days before you become symptomatic until about the first 5 days after symptoms. And for the asymptomatic people, we have no way of knowing when that window is, because when they have a positive test, we don't know when we're catching them. We could be catching them right at the beginning of that window, or weeks after that window is closed and they're no longer infectious at all. So that's the answer in that. There's questions. There were a couple of questions in quarantine. If you're a close contact, meaning you've spent more than 15 minutes at less than 6 feet from someone else, how long you have to quarantine. The CDC just changed the recommendations from 14 days to 10 days. I think that is reasonable. You only get about 1% of people who would, their incubation period would be so long that they would turn positive after more than 10 days. The one place we recommend people really do quarantine for the full 14 days is in nursing homes or assisted living facilities, because the risk of bringing it into a congregate facility is too high for it to even take that additional 1% risk. Let's see, more questions. There's a bunch of questions about flying. When is it going to be safe to fly? Airplanes are actually relatively safe. They have air filters that filter out virus. You can actually get yourself, if you can buy an N95 mask, they're much better at protecting yourself. And my dad just flew to Israel a couple of weeks ago. I gave him an N95 and a regular mask to put over it. The plane itself is not the most dangerous time. It's really the congregating, that people do right as they're getting on and off the plane, So if you can be patient and get on last or get off last and try to maintain your distance, I don't think flying is the most dangerous activity. And even though our numbers are going up, they are significantly higher in some other places. So it sort of depends where you're flying to and from. If you're flying from South Dakota to the Bay Area, is it safe to fly? No. Is it have horrible amount of risk? No. Is it safer for you to be here for months afterwards than to be in South Dakota? Maybe, so it all depends, like, to what degree are you avoiding gatherings and keeping your physical distance and keeping your mask on where you are. What about traveling on BART? I see someone putting in there. I wouldn't do it. If you have an alternative, and not everyone does, but if you have an alternative, the most dangerous situations are ones where you're in an enclosed indoor air space. I don't know if they're keeping the windows open on BART cars now. I haven't been on BART for a long time, but if you are doing a family gathering or gathering with people outside your pod, my number one recommendation is to get some cross ventilation, open some windows and get some breeze going through. It's harder as it's getting colder, but try to plan your gatherings for the warm hours of the day and open some windows. Okay, I'm going to go back to the other questions. How long will a vaccine last? I talked about that. Side effects, talked about that. There was a question about keeping your masks on even after you get a vaccine. I think a lot of people in society will. I think it will take a long time to know how long the protection is good for. I think it also, there's a part of us that's putting our mask on for ourselves to protect ourselves now, and then there's a part to protect others. And also there's a part that's like becoming a social norm, right? Like you don't want to freak people out by not wearing a mask. So there will be a whole part of life in the spring when the vaccine becomes more readily available at massive scale, where some people will have gotten it and they won't be wearing the mask, and everyone will, it will take a little while getting used to that again. Would I wear a mask for personal protection after the vaccine? Probably not. I think after about 2 weeks, give my body 2 weeks after the second dose to develop the immunity, and probably at that point, I would probably not worry about it as much. There was a question about how many people have gotten the disease from asymptomatic carriers. We have no way to know. When we look at our contact tracing in Contra Costa County, the number one category, about 40% of people don't know where they got it. The second category is household transmission. Businesses, stores, restaurants are only about 12% of our cases. So most people don't know, and we don't know how many people have gotten it from asymptomatics. When are asymptomatic carriers thought to be contagious? Also, in those first few days of them having the disease, we just don't know exactly when those days are, because we don't know when the test is relative to their infectious window. Would you speak about being in a car with someone, both masks, windows open for an hour-long drive? If you can really keep the windows open, I think it's not the most dangerous. If you're just two of you, I would try to do one driver and then the other person in the back seat. If one of you had COVID and the other one got it, and contact tracers called you and you said, "Oh, I took a car ride with someone," they would consider you, the other person, a close contact, even if the windows were open and the people both wore masks. Could you speak of the risk of cooking inside with two other people, all masked with the window open? At this point, that's not allowed because we're in a shelter in place. You're not supposed to gather with people outside your pod. Risk, again, I don't know I don't have numbers to put on it, but I can tell you that putting masks on and opening the windows is better than not. Regarding vaccine distribution, the question is, when will people in congregate settings receive the vaccine? And does it include prisons, jails, ICE detention centers? Those are not in phase 1A. There's talk about them being in phase 1B, so probably more like January, February, as far as detention centers. And the congregate settings for elders, it could be as early as January. I know in Contra Costa County, we're choosing to use some of our very first delivery to give to people in congregate settings, but it's not going to be enough for all of them. By the way, when you look at national surveys, only about half of the population is willing to accept the vaccine right now. So I don't think the vaccine will give us anything close to herd immunity anytime before the end of the summer. Okay, looking at other questions. Any questions about buying masks that are very protective? Yes, N95 masks. Any mask is better than no mask, but the N95s will give you more protection. The thing about N95 masks is you have to be, in theory, you have to be fit tested, meaning you want to make sure that there's a good seal, and if you have facial hair, there's never a good seal. But you can usually tell when you wear them. Like you can sort of feel around and see where air is escaping, and it's fine for air to escape out. You just don't want it to come in from the sides. You want it to come in through the mask. There was a question, given that young children carry the less virus, do you think it's safe to hang out with a 14-month-old grandson for 3 to 4 days after a flight? I would say that's sort of young. If you said it was like a 5 or 6 year old kid, I would say they've probably had a lot of their childhood colds from being in preschool, and probably have some cross protection from having gotten other coronaviruses, and are less likely to carry COVID. A 14-month-old probably much less innate protection in their body. So I would try to, after flight, and also a 14-month-old is not going to keep their mask on effectively on a flight. So after a flight, if you really wanted to be safe, I would try to do maybe 8 days afterwards, and maybe even ask the family, the parents and the kid to swab before you gather with them if you're over 65. Okay, and I think that's all the pre-submitted questions. I think that we can now go to the chat, and also let's see, I'm just going to start from the beginning. There was a question about how is the vaccine process happening so quickly? Yes, they usually do take years to approve. The reason that everything's happened fast is severalfold. One is the regulators are letting something slide that they wouldn't normally let slide, just because of severity, fact that almost 300,000 people have died and they want to prevent more. And two is there's an inordinate amount of money and resources going into this relative to most vaccine development processes. There's probably 80 different vaccines in the pipeline. So lots of companies trying all sorts of methodologies, lots of new delivery systems. There's something that they hold up to your skin and it gives you like it's electric current vaccine. There's a skin patch vaccine. There's going to be all sorts of stuff that we've never seen before coming through in the next few months. Next one, is there a reason to be concerned that it's so quick? Yes, I would be concerned, but also I would weigh that against the fear and concern about COVID. So yeah, I wish there was a better answer than that. If you've had the vaccine, can you still transmit the virus? Don't know. That's a great question. Given the vaccine has not been tested long-term, do we know about side effects on fertility of other conditions over time? Also, don't know. Can you talk about what the research is saying about the most likely ways to contract the virus? People have a lot of different opinions. For example, airplane and grocery store. I talked a little bit about that. Yeah, indoor air. It's clear indoor air, especially unmasked, especially close quarters with other people. So if you're concerned, try to minimize indoor gatherings, especially with others. Try to keep your distance, try to wear a mask. Go to the store hours that are, if you qualify, that are dedicated to fewer people or the elderly. Let's see, have the vaccines been tested on people who are older? Yes, they've made a specific effort to test on the elderly and on people of a variety of ethnicities. Actually, that slowed down one of I think it was the Moderna vaccines. They went back and added more Black and brown people to their testing cohort. The good news is that the elders, at least with the Pfizer and Moderna vaccines, seem to have good immune response. Oh, and I didn't mention this, but this is something to know. The vaccine is what's called reactogenic, meaning you do feel bad after taking it for 2 to 3 days. The muscle often hurts where they inject it, And you'll also have sort of body aches. You can feel like almost a flu-like thing, body aches, and sometimes even a low-grade fever. It doesn't mean you got COVID. This vaccine can't give you COVID, the way I understand it, but it means your immune system is doing what it's supposed to do, which is reacting to it, which is then going to initiate the immune response. But I would expect after you get it, in particular the second dose, that you might be out for the count for a few days. So don't make any plans. If you're planning to get the vaccine, then it's good to know that that's coming and to expect that. Not everyone will have that reaction, but a fair number of people are having that. Do we need to shelter in place if we're only seeing other people outside 6 feet apart? I would say probably not if you're in a place with decent airflow. I think the risks are really small. We know from the White House Rose Garden ceremonies that outdoor gatherings can transmit, but they in general were not keeping distance or wearing masks. Is it safe? It's safer not to gather, but it is. I would say it's quite low risk to be outside where there's good airflow. So it's all a spectrum. It's not like you're not going to get an answer from a public health person who says, yes, this is safe. But do I go out hiking with people outside my pod and we keep our distance and keep our masks on? Yes, because it's we're all isolated. It's really important to have some human contact. And if you're going to have human contact, outside mask contact is the best way to do it.
There was a question a little bit earlier asking if we should still coordinate grocery packaging and mail, and how long should uncoordinated mail sit before we open it?
Oh, not really. Food, mail, packaging, people, no, we really are not seeing documented cases of transmission happening that way. There was a lot of fear about that early on, but we're just not seeing that. If you're concerned, I would leave things for 3 hours, and usually that will most of us have enough willpower to await on even the best Hanukkah presents for 3 hours. A single person who lives and works at home has mostly been isolating and received a negative test just before visiting. Visits the home of a household of 2 have been as careful as possible. Yeah, that's a relatively low risk visit, Julie. It's not a 0 risk, but it's a low risk. So yeah, being tested the day of a visit is a strategy that gives some reassurance, I would say. If you test negative the day of, it's better than testing negative the day before, which is better than testing negative 2 days before. So the closer to the visit, a negative test can be helpful. So I think I've heard a lot of questions about merging pods. If everyone gets tested on the same day, can you merge pods? It's better than not being tested and all being negative on the same day. But remember, all of those people could be somewhere in their 10-day incubation period. So having a negative test, but still end up positive a few days later. The question about merging pods also is complicated because there's the moment of the merge, which everyone's worried about. But then there's also all the behavior of all the pod members after you've merged, and so you're only as strong as your weakest link, so the larger the pod, the harder it is to know what your risk is. Discrepancies about current orders, why playgrounds closed, and are they telling people not to walk with one another outside, and malls are open, large stores like Costco are open. Are we hearing that inside is the safest way to be with others? Oh yeah, I can see how that's a mixed message, Debbie. I think the playgrounds is one of those, yeah, it's outside, it's less risky. I think they're worried about people getting too close to each other, even outside. And but yes, I agree. The whole like parks and beaches closures gave a mixed message early on, and I'm of like mind with you that the messaging should be outside is safer than inside. Why are stores still open? Part of it is because they carry some necessities, and then it's America. Don't the new shelters in place say we should not do anything with people outside our household? Yes, they do. What do people who are living alone do about seeing people in person? Make really difficult decisions. I mean, I wish I had a better answer than that, but this whole, I mean, that's part of why it is so hard to go through this for so long. It's particularly hard for people who are already isolated in nursing homes and so forth. Why no congregating outdoor and distance? If you're going to congregate, do it outdoor and distance. I think that's a reasonable compromise, you know. So, good question. I think I covered most of what. Oh wait, no, sorry, I just haven't scrolled down. So, there's a lot more there. Let's see. Are there people with certain health conditions for whom the vaccine will not work, like people with autoimmune disease? That's a really good question. We don't have the answer to that yet. I don't think they've done enough trials on people with autoimmune disease to know the answer to that. They will, but we probably won't know the answer for months, if not years. Post-vaccine transmission, has data been collected, undergoing analysis? Yes, they are. I mean, each of these companies, Moderna and Pfizer, that have submitted for an FDA emergency use authorization, have enrolled more than 50,000 people and are continuing to enroll and follow people. So I think we will have answers to some of these questions soon, but not yet. Are any of the vaccines that are coming soon inactive? I think that's sort of a little bit of old terminology. We used to have sort of live attenuated vaccines that could give you the disease versus inactivated vaccines that couldn't. I think people are thinking of like polio. I would say that these vaccines that are being given now, none of them can give you coronavirus. They all have, but some of them are just a piece of RNA. And then some of them are a piece of RNA that's sliced into another virus's genome, like an adenovirus. That's a known way to give a vaccine. So you are getting another virus. It's hard to call it live because there's debate whether viruses are alive at all. But it's because they're just a collection of DNA or RNA without the other hallmarks of life. But I would say that none of these can give you coronavirus, if that's the question. If the virus can live longer periods when refrigerated, can enough survive in refrigerated food to transmit the illness? Unlikely. Don't know for sure, but unlikely. Is it safe to cook or bake something and bring it over to a neighbor and leave for them? Yes, I would do that. I have done that. I have eaten stuff that people have brought to me. The question is more policy oriented. Can you talk about travel restrictions? Oh yeah, and this was another pre-submitted question I forgot to answer. I don't think we'll ever have like absolute travel bans again. If anything, the restrictions are going to slightly lift over time. During shelter in place, it is true that hotels are only supposed to take people for essential travel. Also within California, it's really the hotel in the shelter in place area is supposed to only take people for essential travel. Are they enforcing that? Not really. I mean, if someone calls to book a reservation, they're going to take the reservation. They may say, are you traveling for essential travel, you know, and have you say yes. But I don't know if anyone is enforcing beyond that. Do I think a travel ban will be enforced? No. I think I think this is as strict as it's going to get that way. Is it important to wash food and packaging that you bring home? I don't think so. If it was safe enough to gather outside 6 feet apart before, is there a medical reason to stop doing it now, or is it folks who are not observing that behavior? Yeah, people don't observe the behavior. Some people don't want to. Some people just, they're touchers, they're close talkers, they're huggers. Some people aren't comfortable with their mask, so they take it down. But yeah, if you're more than 6 feet outside where there's good airflow, I think that's relatively safe. Relatively. Still less safe than not gathering at all, but relatively. Are the vaccines safe for people with mast cell disorders? I don't know the answer to that. Should we put off essential medical visits such as mammograms? That's a complex question. I would say I would probably not consider mammograms essential. I would say something like that you can put off. I say that because the data on mammograms is unclear whether they actually save lives or not. And certainly it's unclear enough that even if they do have a benefit, it's a small benefit that to me, it's fine to wait a few months more on. And then the real question is all the other things, right? Not just mammograms, but also colonoscopies and other cancer screenings and visiting your doctor for your high blood pressure and your diabetes. Most medical visits now have a telemedicine option, video or telephone. Occasionally, a physical exam is important, but remarkably few times. So I would try to continue to get care, and if you have something that, a growing mass, something where a physical exam is important, or worsening trouble breathing, like if it feels very serious, then I would definitely go in. I'll tell you this, the PPE really works. In our health system, hundreds of thousands of patient visits, not one case of transmission from a patient to a healthcare worker. All the healthcare workers that are getting it in our particular system have been like a lunchroom around their colleagues where they let their guard down, or they brought it from home. So if you feel like you're going and you can be the first appointment of the day and not be in a crowded waiting room, it's really the waiting room that's probably your highest risk. And you can even go and say, oh, you see other people there, say, I'm going to wait outside. Will you call me when my turn comes? So there's some measures you can take to reduce that risk. Is there some kind of vaccination card or badge? You will be given documentation when you get your vaccine. The state of California has required that all vaccines be documented in a centralized state database that already exists. It's called CARE, but it's where we put all the other vaccinations. And they said that you have to do it within 24 hours of vaccinating someone. That's one of our big logistical challenges in vaccinating folks, is documenting it effectively. So it will be in a centralized record, and also you'll be given a piece of paper. Whether they're going to give cards, I don't know. Too early to tell. Will vaccination be required? No. I don't think any health authority is willing to make a vaccine that's mandatory, that's only under emergency use authorization. Nobody wants to require that. It is possible that some employers will require vaccination, and I think they're allowed to require that. You can say, I don't want to get it, but then they could say, okay, then you can't work here. But I don't think any health authority will require it, and I sort of don't think most employers will. I think it will remain voluntary to a large extent. Maybe some nursing homes or some congregate settings will require it. Did I cover everything? Elle, did I miss
You
anything?
did. You got them all. Yeah.
I saw
Okay.
a question, Ori, about can college students fly home under the current shelter-in-place order? And in general, is there any enforcement of travel restrictions, particularly at airports?
No. Well, yes, college students can fly home if they have nowhere else to be. I think some people will call that essential travel. Nobody's looking at that level of detail and enforcing it. There's no enforcement of travel restrictions anywhere by anyone. There's just not enough people to do that. And the only people that may enforce some safety measures are the airlines, which some of them are now requiring negative COVID tests before you fly to certain places. They're all basically requiring masking. But nobody's going to tell you, yes, you can do this travel, or no, you can't. So it's really an individual decision. And yeah, college students coming home, we think, was a big factor in this Thanksgiving wave. I think we can unmute people. Yeah. Oh, go ahead.
About the decision-making process around vaccinating people incarcerated and in detention centers. I think part of that is also the staff as opposed to the people being detained. Who makes those decisions and how will they be made?
So I think, again, it will be voluntary as far as nobody will be forced to take it. When will it be offered to the staff is the big question. And in general, I think there's 3 waves of vaccination. The first wave, wave 1, is when there's much more limited vaccine, and that might last 3 or 4 or maybe 6 months. After that, there will be plenty of vaccine, and then it will be the general public, wave 2, and then after that, wave 3, the stragglers. Jails, detention centers should be part of wave 1, but not the very first part of it. So I think 1B.
Is that just staff, Ori, or staff and inmates both?
I think staff and inmates both. Probably the staff will be offered it before the inmates are. And who makes that decision? It will probably be up to the jurisdiction. So if it's a federal jail, it will be up to the feds. If it's a state prison, it will be up to the state of California. If it's a county jail, it will be up to the county. I think if it's ICE, it will be up to the Department of Homeland Security. So yeah, I think there are no mandatory things, and I think there's a ton of politics in those decisions, right? Like when you offer it to incarcerated folks, some people say, hey, you know, that's, you know, they're stuck there, they can't go anywhere, they can't make a choice. They should be the first to get that offer. And then other people say, why is an incarcerated person being offered before I, as a member of the general public, am offered? So it's a very political decision. And I have some influence about what Contra Costa County will decide, but all the other jurisdictions will be making their own decision.
Somebody asked if you know the contagion level in Alameda County, Berkeley, or Oakland compared to Contra Costa.
Very similar. We're neighboring counties. We're I think the cases per 100,000 have been almost identical. Sometimes Contra Costa is a little higher, sometimes Alameda is a little higher. Alameda has less affordable housing than Contra Costa. I mean, there's some, but I would say it's quite close. So I say affordable housing because a lot more transmission happens in dense households, and a lot of the Latinx workforce, even if they work in Alameda County, often live in Contra Costa County and commute in because there are some cheaper housing options in Contra Costa.
And then there's another question: what kind of isolation period would you recommend between one grandparent pod to another sheltered grandparent pod?
I guess I don't understand the question. Isolation period. Merging pods, or maybe there can be some clarity there.
Ruth, could you write whether you mean merging or
you can also unmute, Ruth, and just ask.
yeah.
Yeah, the question was, how long should the child be separated from going from one grandparent pod to another grandparent pod?
Oh, the child.
Oh, well, if they're going straight from one to the other with no stop in between and no other contact with any other household.
Okay, I'm still not understanding. I'm sorry. So the child is with one set of grandparents and then wants to join the other grandparents.
With their parents, of course.
With their parents. And the question is then,
is there any isolation period required, or can you go from one zero contact outside to another zero contact outside?
Oh, I see. Right now, so I guess there's two aspects. There's like the legality, and then there's the medical risk. So right now, I think you're not supposed to gather with people outside your pod. So if the other set of grandparents is not in your pod, neither the parents nor the child should be podding up with them. And then from the medical risk perspective, if you're saying, okay, we're a pod and we're gonna pod with someone else now, how do we minimize the risk of us giving it to them or them giving it to us? Then I would say both, when merging pods, if you want to be 100% safe, both pods should fully isolate, like tighten up their pod for 10 days and then test themselves maybe on day 7. So by the time day 10 comes around, you have your test results. And then it's okay to merge the pods. I think that if I was merging pods, and that's what I would do. I would really tighten up the container for 10 days and test on day 7.
Rats.
What's that?
Rats.
Rats, oh yeah.
Can I ask a follow-up question to that, Ori?
Sure. Hi, Valerie.
Hey, thanks for this. It's amazing. My understanding, and maybe I read it wrong, of the CDC guideline was that when they reduced to the 10-day, it included a test at the day 10.
No, they had two. Valerie's talking about the recent CDC recommendation that reduced quarantine from 14 days to 10 days or to 7 days plus a test. So that's a quarantine recommended. So it's not pod merging exactly, but it's a quarantine if you had contact with a known positive, which people are extrapolating from that to pod merging. But yeah, they gave two options. They said if you go from 14 to 10 days, that's acceptable because you've gone from 100% efficacy to 99% efficacy. But then they gave another option, say you can actually go down to 7 days and test also within 48 hours of that 7 days. And when people did that, it went from 100% to 95%. So it really, it introduced more risk. It's still 95% effective, but it's less safe than the 10-day option.
So you saying you test on day 7 or you test before day 7 and you get together on day 7?
What the CDC said is test within 48 hours of that day 7. So the reading between the lines is you can test as soon as day 5, but not end your quarantine until day 7.
Got it.
But again, that's less safe than quarantining for 10.
So we've got about 2 minutes left. If there's maybe one more question. And while we're doing that, I also want to invite appreciations for Ori in the chat.
Maybe I'll ask a question if I could.
Sure.
I've been going on walks once a week, kind of socially distanced walks with maybe 5 other people, and we all wear masks and we keep 6 feet apart. Or well, actually, we haven't been super strict about that, but can we continue to do that if, and I'm in Berkeley, if we're wearing masks, if we strictly keep 6 feet apart and we go on walks? I was trying to read the health regulations, and my reading of it was that it was acceptable.
It is.
Oh, thank you so much. Okay,
Yeah.
appreciate that, because we really have enjoyed doing that. Okay.
Oh yeah, and we all need to get out sometimes and to move sometimes. So I think that's very reasonable and relatively quite safe.
Thank you.
Let's take, is it Veda or Vita?
Yeah, thank you. So
Yeah.
this is a really simple question, but I'm confused about pods. So is the assumption that everybody in a pod has isolated or just been out for a walk, that they've not gone to the market, they've not gone to work? So they're out there anyway.
Yeah, you're totally right. Each pod, you can almost assign it a risk score. Like my pod includes my teenage daughters who occasionally gather with friends outside, and me who occasionally goes into the office, and my brother who works at a grocery store, and our neighbor and her twin kids, and they go to daycare and she's a healthcare worker. So there's some level of risk introduced to our pod, and it's a less tight pod. Some people try to keep a really tight pod. They really don't, they when they get the groceries delivered, they don't go to work. That's safer than my pod as far for COVID transmission. So you're right that even podding is not a guarantee to not get COVID. But if you're in a relatively tight pod, then it's a relative level of protection, and it works, reduce the number one thing you can do to increase your risk of COVID is share the airspace of a lot of other people, so if you share it with less people, that's safer. When you keep your mask on, that's safer. When you keep your distance, that's safer.
Thank you, and thank you so much for this. It's been very useful.
Thank you, Ori. Thank you, Nicolia, for closed captioning. Thank you, Elle and Maggie, for tech support and helping to organize and keep everything smooth. Thank you, everybody, for coming.
And thanks, and stay strong and positive, everyone. It's so hard, I know, and it's so nice to have Kehilla as a community and be with each other and just see each other, all the friendly faces on the screen. So this will get better. I think we're still a few months away. The winter will be hard, but I really appreciate all of you, and just we all have our struggles, whether it's fear of getting sick or isolation or not knowing when this will end, or separation from family. So I appreciate all of our individual struggles and knowing that we can get through this individually as a community also.
Yeah, thank you so much. And please do be in touch with us too. We have our mutual aid system set up. We have the Rabbi's Discretionary Fund available for financial challenges. We have all kinds of ways to try to stay connected and stay grounded and stay with each other in our spiritual practice and our seasonal practice. Hanukkah starts this week. We're going to have a gathering every night of Hanukkah to do candle lighting. So we invite you all to join us for that. And stay safe and warm. Thank you again, Ori.
Bye, everyone. Take care.
Good night.
Good night.